They're lying about how many people passed away. They're not giving correct numbers.
Vincent Pierce is one of the younger nursing home residents at Kohler Hospital on Roosevelt Island and says he feared being housed with COVID patients even after the state reversed its directive about admitting them.
By then it was too late. We was already 2.5 months into the pandemic. Like a lot of people died that didn't have to die.
Kohler is run by New York City's Health and Hospitals Corporation. It listed 13 confirmed COVID deaths with the state. 45 were presumed. Staff complained back in April they were getting ineffective personal protective equipment, PPE.
This is the cheap stuff, and we had to treat people that are contaminated with coronavirus.
Representatives for nursing homes testified that even before the pandemic, they had staffing shortages, and they're getting worse now.
Many people do not want to work in long-term care now. They have families, there's anxiety, there's fear with this, and they're looking elsewhere for career options.
And the owners said they get $64 a day less per patient from Medicaid than many other states, yet they're still expected to keep up with infection control.
Nursing homes in April, in one of the busier weeks, we're going through 12 million pieces of PPE per week.
Brooklyn Assemblyman Charles Barron wanted to know how the state will prepare for the expected next wave of COVID in our Black and brown communities in particular. A suggestion came from Jerry Maldonado, who lost his mother to coronavirus in a Hudson Valley nursing home.
The state should be preparing right now to send COVID positive patients into specialty care facilities.
Lack of testing led to lack of information about Virginia Wilson Butler's aunt, who died in Bushwick.
They stated she had pneumonia, but her death certificate said that she died of natural causes.
Mrs. Wilson Butler said that many residents are afraid to complain about their care because they fear retaliation from staff. She suggested putting cameras in patient rooms. Some nursing home residents are starting to feel very isolated in their rooms because many have not received visitors since late February. I'm Mary Murphy, Pix 11 News.